Okay, so have you ever had one of those days where like everything just seems to snowball out of control?
Yeah, I think we all have those days from time to time.
Right, like when you just make one small mistake and then it just kind of creates this ripple effect and suddenly you're dealing with this like huge mess that you never saw coming.
Yeah, definitely. It's like that feeling of, when you trip over a tiny crack in the sidewalk and then suddenly you're like sprawling on the ground and everyone's staring at you.
Yeah, exactly. And today we're going to be diving deep into this idea and talking about how we can actually kind of anticipate those cracks in the sidewalk, so to speak.
Right. Like, how can we kind of develop a way of thinking that helps us avoid those pitfalls in the first place, or at least minimize the damage when we do inevitably stumble?
Exactly. And the best part is we have this really interesting story to guide us through this whole thing.
Yeah.
It all starts on this like brutally cold winter night in Montreal. I'm talking like minus 40 degrees, the kind of cold that just like goes right through you.
Oh, wow.
Yeah.
Yeah, that's pretty intense.
Yeah. And our speaker, who happens to be a neuroscientist, is coming home late from work. And as he gets to his front door, he sees his keys sitting right there on the dining room table inside.
Oh no, I can already see where this is going.
Right. It's like that moment of realization where you just know things are about to go downhill fast.
And being locked out in that kind of weather is not a joke.
Definitely not. So, of course, he tries every door, every window, everything is locked. Calling a locksmith at that hour in that weather was just not an option.
Yeah, I can imagine that would be a nightmare.
Plus, he had an early flight to Europe the next morning, so he needed his passport and his bags, which were all packed and ready to go inside.
So he's basically stuck between a rock and a hard place.
Absolutely.
What?
So, after trying like everything he could think of, he makes this split-second decision to break a basement window to get in.
Oh, wow. So not only is he locked out, now he has a broken window to deal with.
Exactly. And this whole situation really got him thinking, how could he have avoided this whole mess in the first place?
Right, because, on the surface, it just seems like a simple case of forgetting his keys. But clearly there's more to it than that.
Yeah, there's this underlying question of like, how can we anticipate these kinds of problems before they even happen, especially when we're stressed or under pressure?
Because let's be honest, when we're stressed out, our thinking isn't exactly at its sharpest.
Right. So he's dealing with a broken window. He's got this trip coming up. He's totally sleep deprived. And all of that is just pumping cortisol into his system.
And as we know, cortisol, that stress hormone, it really messes with our ability to think clearly.
And the worst part is that he didn't even realize how foggy his thinking was, because his thinking was foggy. It's like this vicious cycle.
It's like your brain is telling you everything is fine while you're simultaneously making a series of bad decisions.
Exactly. And you know what happens next, right?
Let me guess. In the rush of getting to the airport, he forgets something crucial.
You got his passport. He completely forgot his passport at home.
Oh no, so now he's got to race back home in the snow, get his passport, and make it back to the airport in time for his flight.
Yep, another mad dash through the snow, another frantic race through the airport. He makes it onto the plane with like literally seconds to spare.
I bet his heart was racing.
Oh, I'm sure it was. But the story doesn't end there. He gets to his seat all relieved and ready to finally relax, and he finds out that his assigned seat is gone.
Oh, come on. So now he's stuck in a middle seat for this long flight to Europe.
Yep, 8 hours crammed into this tiny non-reclining seat next to the restrooms. Talk about adding insult to injury.
Yeah, that's definitely not the way you want to start a vacation.
Not at all. But you know what they say? Sometimes the worst experiences can lead to the most valuable lessons.
That's true. Sometimes it takes a really difficult situation to make us stop and reassess how we're doing things.
And for him, this whole ordeal really planted the seed for a new way of thinking.
It's like that saying, sometimes you have to fall flat on your face before you can learn to walk.
Exactly. And it wasn't until like a month later that he really had this aha moment. He was having dinner with Nobel laureate Daniel Kahneman.
Wow, now that's someone you don't get to have dinner with every day.
Right. And he was telling Kahneman about this whole Montreal disaster. And Kahneman introduced him to this concept called prospective hindsight.
Prospective hindsight. That's an interesting term.
Yeah, it's also known as a pre-mortem. And Kahneman had learned about it from psychologist Gary Klein.
So what exactly does prospective hindsight or a pre-mortem involve?
Well, it's kind of like the opposite of a post-mortem. You know how in a post-mortem you analyze something after it's happened to figure out what went wrong?
Right, like when there's been an accident or a failure, you try to piece together the events that led up to it.
Exactly.
Yeah.
But with a pre-mortem, you're basically looking ahead. You're imagining that something has already gone wrong, and you're asking yourself, what could have caused this?
So it's like a mental simulation where you're trying to predict potential problems before they actually happen.
Exactly. And the goal is to use that information to either prevent those problems from happening in the first place, or to at least have a plan in place if they do.
So it's all about being proactive rather than reactive.
That's the key. And that's what we're going to be exploring in this deep dive today. How can we use this idea of a premortem to navigate those stressful situations that we all inevitably face?
Right, because let's be real, life is full of unexpected twists and turns, and we can't always control what happens to us.
Right. But we can control how we prepare for those challenges and how we respond to them.
Exactly. And that's where premortem thinking can be so powerful. It gives us a framework for thinking ahead and anticipating potential problems before they catch us off guard.
So let's start with something that might seem really simple, but it's actually super effective, and that's getting organized.
Organized, you mean like cleaning up our desks and stuff?
Well, yeah, kind of. But I'm
Yeah.
talking specifically about creating designated spots for those items that we tend to lose all the time, like
Yeah.
keys, wallets, glasses, passports.
Okay, yeah, I'm definitely guilty of misplacing those things more often than I'd like to admit.
Right, we all do. And our speaker, who's a neuroscientist, explains that there's actually a reason why we struggle to remember where these things are.
Oh, really? So it's not just me being absent-minded.
Nope, it has to do with how our brains are wired. You see, there's this part of our brain called the hippocampus.
The hippocampus, yeah, I've heard of that. It has something to do with memory, right?
Exactly. And the hippocampus is this ancient part of our brain that evolved to help us remember the locations of important things.
Important things like what?
Well, think about our ancestors. They needed to remember where to find food, where to find water, where to find shelter.
Right, those are pretty essential things to survival back then.
Exactly. And so the hippocampus became really good at remembering the locations of those fixed things, things that didn't move around a lot.
So that's why I'm so good at remembering where the fridge is.
Well, yeah, maybe. But it also explains why London taxi drivers who have to memorize these incredibly complex street layouts have been shown to have a larger hippocampus.
Oh, wow. So their brains have actually adapted to the demands of their job.
Exactly. And it also explains why squirrels can find those nuts that they buried months earlier, even without relying on their sense of smell.
So they're using their spatial memory to remember where they hid their food.
Exactly. And the thing is, this system that works so well for remembering fixed locations, it's not as effective for items that are constantly moving around.
Ah, so that's why I can never find my keys.
Exactly. Your keys are always moving from your pocket to your bag to the counter to who knows where.
Yeah, that makes sense. So how do we combat this?
Well, the advice might seem obvious, but it's really all about creating a designated spot for each of those essential items.
Okay, so like a hook by the door for keys, a specific drawer for your passport, a certain spot on your nightstand for your glasses, that kind of thing.
Exactly. And the key is consistency. You have to be really diligent about always putting those things back in their designated spot.
So it's like training your brain to associate those items with a specific location.
Exactly. And it sounds simple, but think about how much time and stress we could save ourselves if we just implemented this one little habit.
Yeah, I mean, I can't tell you how many times I've been late because I couldn't find my keys.
Right. And it's not just about being on time. It's about reducing that overall feeling of chaos and stress that comes from constantly searching for lost things.
So it's like creating a sense of order in our environment, which then translates to a sense of calm in our minds.
Exactly. And while we're on the topic of pre-mortem thinking for everyday life, here's another really practical tip, especially for travelers.
Okay, I'm all ears.
Take pictures of all your important documents with your phone.
You mean like my driver's license, my passport, my credit cards?
Exactly. And then email those pictures to yourself. That way, if you lose your wallet or your bag while you're traveling, you have easy access to all that important information.
That's a great idea because trying to remember all those numbers and details when you're stressed out is next to impossible.
Right. And it can make the process of getting replacements so much smoother.
Definitely. So it's not just about preventing the loss, it's about minimizing the damage if a loss does occur.
Exactly. Okay, so those are some of the more obvious applications of pre-mortem thinking,
Yeah,
like getting organized and being prepared.
right. Those are things we can do in our everyday lives to reduce stress and avoid those little mishaps.
Exactly. But now let's talk about something a little bit more complex, and that's using pre-mortem thinking to navigate those really stressful medical decisions.
Okay, yeah, that's a whole other level of complexity because medical decisions can be so overwhelming.
They absolutely can, and especially when you're dealing with a new diagnosis or a serious health concern, it's easy to feel like you're just not thinking clearly.
Right, you're scared, you're confused, you're trying to process all this information, and it's hard to know what questions to even ask.
Exactly. And that's where having a pre-mortem mindset can be so valuable. It's about taking the time to think through potential scenarios and to prepare yourself for those difficult conversations with your doctor.
So it's like having a game plan going into those appointments so you're not caught off guard.
Exactly. And our speaker gives this really common example of a situation where your doctor recommends a statin for slightly elevated cholesterol.
Okay. Yeah, statins are pretty commonly prescribed for high cholesterol.
Right. And a lot of people might just accept the recommendation without really questioning it.
Yeah, because you trust your doctor, you want to do what's best for your health.
Exactly. But our speaker suggests asking this one really crucial question.
What's that?
What is the number needed to treat? Or NNT for short.
NNT, I've never heard of that. What does it mean?
Well, the NNT tells you how many people need to take a particular drug or undergo a particular treatment for one person to actually benefit.
Oh, so it's a way of measuring the effectiveness of a treatment at a population level.
Exactly. And what's surprising is that this NNT statistic is often not discussed by doctors or pharmaceutical companies.
Really? Why not? It seems like that would be pretty important information for patients to have.
It absolutely is. And our speaker cites research by Jerome Groopman and Pamela Hartzband, which was also confirmed by Bloomberg.com, that found that the NNT for a commonly prescribed statin is around 300.
300, that means 300 people would need to take that statin for a year to prevent one heart attack, stroke, or similar cardiovascular event.
Exactly. And that can be a pretty eye-opening statistic, especially if you're the one being prescribed the medication.
Right, because you might be thinking, okay, even if it's only 1 in 300, I'll still take it to reduce my risk.
Exactly. But that leads to the next really important question, which is, what are the potential side effects?
Yeah, because every medication has potential side effects.
Right. And for this particular statin, the data suggests that around 5% of patients experience side effects, which can include things like muscle and joint pain, gastrointestinal issues.
Okay, so let's do the math here. If 300 people take the drug, one person might benefit, but 5%, which is 15 people, will experience side effects.
Exactly. So statistically, you're actually 15 times more likely to experience a negative side effect than to actually benefit from taking the statin.
Wow, that's a pretty significant difference.
It is, and our speaker's really careful to emphasize that he's not saying whether or not you should take a statin.
Right, because that's a decision that each individual has to make in consultation with their doctor.
Exactly. But the point is to highlight the importance of having all the information before you make that decision.
Right, you need to understand both the potential benefits and the potential risks, and you need to weigh those against each other.
Exactly, and this really gets to the heart of informed consent.
Informed consent meaning you have the right to know what you're agreeing to.
Exactly. You have the right to know the potential benefits, the potential risks, the likelihood of success, the likelihood of complications.
And the NNT is a really important piece of that puzzle.
It absolutely is. And to drive this point home, our speaker shares another example this time. It's about the most common surgical procedure for men over the age of 50, which is the removal of the prostate for cancer.
Okay, so this is a pretty serious surgery.
It is, and the NNT for this surgery is around 49, meaning that 49 men need to have this surgery for one man to experience a benefit in terms of increased survival.
Okay, and what about the side effects?
Well, a significant percentage of patients, around 50%, may experience side effects like impotence, erectile dysfunction, urinary and fecal incontinence, even rectal tearing.
Wow, those are some serious side effects.
They are, and these side effects can last for a year or two, even for those considered to have a successful outcome.
So even if the surgery is technically successful, it can still have a major impact on your quality of life.
Exactly. And that's why premortem thinking is so important in these medical situations. It's about thinking beyond just the potential for extending life and considering the potential impact on how that life will be lived.
Right. It's about asking yourself, what's more important to me? A longer life with potential complications or a shorter life with a higher quality of life?
Exactly. And it's also about having those difficult conversations with your family members beforehand.
Yeah, because they might need to make decisions for you if you're not able to.
Exactly. Okay, so we've talked about how premortem thinking can help us with everyday things like getting organized, and we've talked about how it can help us navigate those really complex medical decisions.
Right. So we've covered a pretty wide range of applications.
We have. But now I want to take a step back and talk about the bigger picture. How does stress affect our brains? And why is this whole idea of premortem thinking so important?
Okay, yeah, because we've been talking about the benefits of premortem thinking, but we haven't really delved into the science behind it.
Right. So as we mentioned earlier, stress triggers the release of cortisol.
Cortisol, the stress hormone.
Exactly. And cortisol has this really interesting effect on our brains. It basically diverts resources away from non-essential systems.
Non-essential systems like what?
Well, things like digestion, immune function, even libido can be temporarily suppressed when we're under stress.
Oh, wow. So it's like our body is going into survival mode. It's
Yeah.
shutting down everything that's not absolutely necessary for immediate survival.
Exactly. And unfortunately, one of the things that gets sacrificed is our capacity for logical and rational thought.
Oh, no. So that's why we make bad decisions when we're stressed out.
Exactly. It's like our prefrontal cortex, the part of our brain responsible for planning, decision-making, and impulse control, it kind of goes offline when we're in that fight or flight mode.
So we're basically running on instinct and emotion rather than logic and reason.
Exactly. And this is why it's so important to train ourselves to think ahead, especially in situations where we know we're likely to be stressed.
Because in the heat of the moment, when our cortisol levels are high, we can't rely on our brains to be working at their best.
Exactly. And that's where premortem thinking comes in. It's about acknowledging that we're all fallible, we all make mistakes, especially when we're under pressure.
Right. So instead of beating ourselves up for our mistakes, we can try to anticipate them and plan accordingly.
Exactly. And our speaker shared that after his Montreal misadventure, he implemented a really simple premortem strategy.
What was that?
He installed a combination lockbox near his front door and put a spare key inside.
Okay, so now he never has to worry about being locked out again.
Exactly.
Oh.
It's a small change, but it has the potential to prevent a lot of stress and hassle in the future.
And it just goes to show that premortem thinking doesn't have to be complicated. It can be as simple as identifying a potential problem and coming up with a practical solution.
Exactly. And he was also quick to point out that he's not perfectly organized.
Okay.
He still has piles of unopened mail and unread emails.
So he's not claiming to be some kind of productivity guru.
No, not at all. He's just saying that premortem thinking is about progress, not perfection.
It's about making small changes over time and focusing on the areas where those changes will have the biggest impact.
Exactly. So to wrap up our deep dive today, remember, this premortem thinking is all about being proactive.
It's about taking the time to think ahead, to ask yourself what could go wrong, and to come up with strategies to either prevent those problems or to minimize their impact.
Whether it's as simple as designating a spot for your keys or as complex as researching the NNT for a medical procedure, the goal is to be prepared for those inevitable bumps in the road.
And by taking those steps to be more proactive, we can save ourselves a lot of time, money, and stress in the long run.
And on that note, here's a final thought for you to consider. Take a moment to think about one area in your life where you tend to experience a lot of stress or where things often go wrong.
It could be anything from your morning commute to your work deadlines to your relationships.
Once you've identified that area, ask yourself, what's one small premortem step you could implement today to create a better outcome in the future?
It doesn't have to be a huge change, just one small action that could make a big difference in the long run.
So what will it be? What's your premortem plan?
Think about it, write it down, and then take that first step towards a less stressful, more prepared you.
And that's it for this deep dive. Thanks for joining us.
It's been a pleasure as always.
We'll catch you next time.
Until then, take care.
And remember, think ahead
Be proactive.
and don't forget your passport
Oh, and your keys.
and your sanity.
Yeah, that too.